Dr. Liz Gray and been working at the university in our department for the last 3 years, I guess. And she's a health psychologist too.
Yeah, go for it.
Perfect. Well, I'd just like to introduce then our speakers for today. We're actually fortunate enough to
This meeting is being recorded.
Thank
Sorry.
you. Thank you, American lady. All right, I'm just going to continue. So we're delighted to introduce our speakers today. Firstly, we have Dr. Fiona Gillison, who's actually the head of department in the Department for Health at the University of Bath. So Fiona has been researching in the field of health psychology and exercise, physical activity, nutrition for many years now. She's been at the University of Bath for almost all of her career since around 2007, and her research at the moment primarily focuses on how we might be able to support individuals in terms of improving their health behaviours to prevent and reduce obesity. And today Fiona's going to focus on children. Her work also spans adolescents and also adult populations. And alongside her many academic roles, Fiona's also a chartered psychologist, and she's an editor for a journal, so the Psychology of Sport and Exercise, member of the UK Society of Behavioural Medicine, and so on and so forth. So we're very fortunate to have Fiona with us today. Fiona's research associate, Dr. Liz Gray, is also going to be presenting. So they're going to co-present today on a recent study that they've been completing, on focusing on childhood obesity really, and how we can help parents to support their children and interact with them effectively to when talking about weight in general. So without further ado, you're not here to listen to me, you're here to listen to Fiona and Liz. So please start whenever you're ready.
Great, I'm just attempting to share my screen. Can I just check if that's the right thing, that you can all see that?
Yeah, we can all see that.
Yep.
Yeah, that's great.
Well, thank you very much for inviting Liz and I to come and talk. We're very pleased to be here. I've got happy memories of coming and giving a previous talk in 2018. So I've been to double check that we're not repeating anything that we said then, although I wouldn't expect you to remember it. But it's quite nice for us to look back at how things have progressed. And what we thought we would talk about today is a project that Liz and I have been working on together for about 3 years now, which is just thinking about the research we've done in relation to the National Child Measurement Programme and how that can be improved for parents, particularly to improve their experience as well as for children.
Fiona.
Yep.
Sorry, we can only see we can see presenter mode, so we can see your screen with all your notes on.
Oh, I don't know what to do about that. I'll try.
So I don't know if you're on a dual screen mode or anything.
Okay, I'll take dual screen off and try again. Sorry, folks. So let me see. How does that work? Is that better?
It's just coming up. Perfect.
Great, thanks. So what we thought we would talk about today is an example of how we've tried to get the research that we've done used and in practice, and some reflections about that. So we are going to talk a little bit about the individual studies that make up the body of work that we're presenting to you, but more as an example of how do we get the research that we do actually used and actually making a difference. So that's the outline of the tone of what we want to go with for today. I'm now struggling to move my screen forward. Here we go. So it's probably worth just a quick discussion on why we think this project is needed and why we're interested in trying to work in this domain. And the reason is that the rising levels of childhood obesity. So on the most recent data that we have around the previous school year, there are about 9.9% children enter primary school with obesity already, and this rises to 21% by the time that they leave. And this is pretty stable but increasing. So when I look back at last year's numbers, it's a fraction of a percent difference, so not a huge amount, but still going on that upward direction. So we can see that this is an escalating challenge, and more children are living with obesity, which has implications for the rest of their lives. But it also shows us that since we've started measuring these obesity levels and trying to do something about it and trying to do something with the data that we collect, we haven't really made a positive impact. We may have stopped the increase being quite as high as it would be. That might be what we have done, but we certainly haven't managed to reverse it. So I've been working over many years to try and look at the National Child Measurement Programme to see if we can help to do it better and to see what it could do for us that it's not doing already. So for those who aren't familiar, The National Child Measurement Programme is an initiative run by Public Health at the moment, where all children in state primary schools are weighed and measured in their first year, the reception year, and on the year they leave, so when they're 10 or 11 years old. And they get fantastic buy-in. About 95% or more of children who are eligible take part. So we have this fantastic representative sample across the country that tells us how many children are living with obesity. And it started off as purely as a surveillance tool, so for us to know as a nation what the state of play is. But almost by stealth, it has been used as a screening tool as well since that time. And by a screening tool, I mean that it's used to identify particular children who may be living with obesity already or at risk of it, who we think might benefit from some intervention. So school nurses who run this program felt that if they had this information about a child, they should be communicating it to a parent, so the parent had an option to do something about it. So what happens is children get measured and weighed as a cohort. The school nurses don't tell the children what the result is, but they'll send a letter, usually in the post, back to parents informing them of the child's weight status and offering support. And these letters vary a little bit in terms of who it goes to and what support they're offered and what visuals are used, but it's generally giving the information to that proportion of the population whether or not their child is overweight. And what's the impact of doing this? Well, the aspiration is that it's going to help parents take positive action and that we would see a change in weight for those children who are involved. But actually what's happened is a little bit different from that. So I just got a slide to show you some of the headlines that there have been around the National Child Measurement Programme over the years, which give you a flavour of how upset a lot of parents are with receiving the letter. So you can see the lady on the right with her child showing the letter. And you've got to wonder how cross and how angry you would have to be to put you and your child on the front of the metro. And you can see there the sorts of headlines that are around, talking about this letter being a fat letter and talking about the risk of it triggering anxiety and eating disorders. And or the lady on the right, it's her saying that she doesn't believe that it's accurate or true. So I think we need to pay some attention to this. Certainly, if you survey the people who are receiving these letters as a whole, and that includes those whose children are healthy weight, most parents aren't angry, and most parents say that they find it helpful. So we need to keep that in context. But there is this minority who are very much upset by it, and that they're quite vocal, but also they raise some really important points that we need to consider. And one of them is this idea about whether labelling, and I'm using their words here, labelling children as overweight or living with obesity at that early age is actually harmful rather than it is helpful. So if we're not actually improving obesity prevalence through this scheme, what's the risk that we're actually harming children's well-being, and do we know enough about that? And so it's those sort of research questions that I've been interested in pursuing since getting involved in this area. And I think I've got a hot off the press example here today on the bottom right, which you may have seen in the last couple of days. It came out in The Independent, and I know PHE are already trying to work out what their response is, where they've had a lot of bad press for proposing to increase measurement next year to look at the impact of COVID on children's weight. So what they are intending to do, for very good reasons, can be interpreted negatively by those who've got this fear of harm, that unintended consequence. So just to have a look at where we are with the National Child Measurement Programme and what the pros and cons might be, we think about potential benefits. So this is what is intended and what we would like to see. We would like these letters, this feedback, to increase parental awareness of when a child is overweight, because awareness is quite low. It's very hard to tell at the moment because a lot of children are overweight. So children who are overweight don't look abnormal. And it's hoped that by increasing awareness, parents are more likely to take action, and that might be changing things within the home or taking up the offer of support, and ultimately reducing childhood obesity. If we look at the harms that parents propose to us, we get these ideas I've mentioned before. So some parents fear that it harms their child's self-esteem or well-being, and that's because of the stigma that's associated with obesity at any age. Being overweight or having obesity are associated with very negative moral characteristics like laziness, like lack of self-control, and that's associated with children as well as parents by association. Then there is parents who fear the risk of eating disorders, and also through the process of weighing in school, it makes weight very visible and could increase teasing. But my bottom two quadrants here are reflect what the actual evidence shows us. And the evidence shows us in terms of benefits that there is no meaningful increase in the uptake of support or action from these letters. So it might increase awareness. We don't know how long that would last for. And it might increase action. Again, we don't know how long that would last for, but doesn't increase engagement with services. And as we've seen, the rates of obesity haven't decreased. In terms of actual harms, we've looked really hard for evidence of these and done two systematic reviews, well, one systematic review specifically on that up to this point. And there is not much research out there. So on the one hand, there doesn't look like there is evidence of harm, but there's not definitively evidence of no harm either. But we can see evidence that it's alienating for some parents, so it might move them away from following health advice. So the challenges that we face with trying to make sure this NCMP, which is a really, really positive opportunity reaching all of these families, is positive, is that there is a lack of evidence as to whether it works as intended, and also whether the harms that parents are concerned about are negligible or not. It's also really difficult to generate evidence. Liz and I have been writing research grants left, right and centre for the last 3 years, and very few of these get funded. It's because it's quite hard to recruit. Funders know it's hard to recruit, so it's a high risk job, and also it's competitive for any funding. It's also quite challenging to do research in this area. I would question whether any ethics committee would let us do a trial that explicitly said, we're going to test whether it harms children to talk to them about their weight and tell them that they're overweight at the age of 5 or the age of 11. So we can't do a nice RCT that you might do in other areas. We'd have to go about it through more nuanced means. However, having said that, we do need policy now, even if we haven't got the evidence. So how do we deal with that? What do we do? So that's a long preamble to the purpose of the project that we've been working on. And we've been working, sorry, I should have explained on the first slide, we've been working with Angel, your very own Angel, on this project, as well as Lou Atkinson from Aston and Public Health England themselves. So they've all contributed to this wider research project. So what we decided to do to think about, because we have done small scale research projects, it's very hard to recruit in this area. Recruitment rates of people who take part in the NCMP, at best I've seen 10%. We've had about 7%, and I'm reading somebody's thesis at the moment where he's had 0.5%, so I feel very sorry for him. But it's really hard to recruit people to talk about weight and to talk about children's weight because of this stigma and people not wanting to be associated with it or labelled by it. So we were thinking about what we could do with the research that's already available, whether it's ours or whether it's other people's, and we thought we'd start from the end point. What could we do if we were in charge of the world? So we thought about what sort of format, what sort of information it is that we'd want to share, and who it is we'd need to adopt that to take it up at scale. So we took a bit of inspiration from what Paul Chadwick has done at UCL. He worked with PHE to develop this framework for conversation a couple of years ago now, which is aimed at school nurses, helping them to talk to parents about weight. Our project aims to provide some guidance on how parents talk to children about weight. So it's explicitly aiming to tackle one part of this puzzle in terms of how do you, if we're telling parents their child is overweight and they are worried that even mentioning it will cause an eating disorder, how can we help them to understand the best evidence that we've got of how to do that without causing harm? So that is the aim of this part of what we'd like to do. So we looked at this conversation framework that Paul Chadwick had produced and thought there's an opportunity here to work with PHE to do something different for the next level down, so parents to children. So our next stage was then to talk to PHE about whether they'd support this, which luckily they did. And then we thought about what evidence we still need to go into this guidance. So we had collated a lot of evidence that other people had, studies other people had done and that we'd done as well. And we'd also done some systematic reviews to try and tap into this. And we thought there were two other projects that still needed doing, which Liz will tell us about in a while, which we've undertaken as part of this work. And then we thought about how we could make sure that we're informed and credible, because we're not the only people working in this area and potentially not the best people working in this area. We're just two of them. So we thought about how we could involve other academics, but also practitioners as well, to create something that would be useful and acceptable to everyone. And often in this policy area where there isn't evidence to back up every point, there is a lot of expertise among clinicians and people who work with children and families day to day. So we wanted to tap into this too. So what we ended up with, I hope I've reflected in this schematic drawing here. So we wanted to conduct a rapid evidence review. So there was a bespoke piece of work looking at one particular research question, which Liz will go through, but also gathering all the evidence that we were already aware of and the systematic reviews that might feed into this. So that's the kind of academic evidence side of things. We wanted to also review existing guidance. There's quite a lot done on this in Australia, in America, and in Canada, for just 3 examples, as well as work done in this country that is a few years old now, but still really positive. So we wanted to capture the best practice from that document as well. And one of the really big things that is missing in terms of evidence is any work with children themselves. So what do they think about being weighed and measured? Do they want to be told about their weight? Is silence as problematic to them, especially if they're aware of being overweight? Is silence from their parents as problematic as being told by a parent that you might need to manage your weight? So we conducted these 3 projects, and then we got together a group of practice experts as well as academics in a Delphi process to produce some draft guidance, which we came up with in about Easter of this year. And we're now in the process of trying to pilot this with parents of children who are overweight or have obesity. And what we want our outputs to be would be, number 1 here on the chart, that this work is directly used alongside the National Child Measurement Programme, so that when we're feeding back to parents that a child is overweight or might have obesity, they have something that they can physically use to not necessarily have a conversation with their child about weight, but informs them of how to deal with some of the questions children might have when they come up, or how to introduce changes in a way that is thought to be less problematic from that child's well-being point of view. But as we'll talk about, we're not sure what format that will look like, because that will be PHE's decision of what to use and how to use it. But so we would like to also publish the resource we come up with in full somewhere, and that is under discussion. And also we are academics, so we're looking for some academic outputs as well. So that's the framing of what we've been trying to do. So I'll hand over to you, Liz, to talk us through these 3 elements on the left-hand side, but you will need to tell me to nudge on the slides when you need them.
Okay, great. Yeah, great, thanks. Thanks, Fiona. Yeah, so the first study that Fiona mentioned there was the rapid review of existing evidence, which we did with Public Health England. We were specifically focusing on these 2 research questions. So we were looking at the effects of parent-child communication about health topics on children's actual health and well-being. We decided to widen it out to more than just discussing weight and health, but also look at other potentially sensitive but general health topics such as sort of sexual health or physical activity, and body image and bullying. Although we did exclude more sort of clinical areas of health, like, so we weren't looking at, say, talking about cancer or diabetes. The second research question then was, how can we best encourage parents to communicate with children about these health topics and health behaviours? So we searched 5 different databases and initially came up with 14,000 hits, which we whittled down to only 16 eventually included. This was a mix of intervention, observational and qualitative studies. And if you could just skip the, thanks. So what we found in relation to the second research question first, on how we can encourage that initiation or increased communication between parents and children about health. Our findings were mainly, well, we can split them into message delivery and message content. In terms of how we can deliver messages or public health messages to encourage parents to communicate, repeated exposure to health messages can increase the likelihood that those conversations are going to come about. So that would be something like a mass media campaign providing repeated messages that parents might come across in, say, newspapers or on billboards or on radio adverts or something like that. It's going to have more impact than just a one-off message that they see or hear once. There was some evidence that we might need to take a different approach for mothers and fathers. This is partly because fathers tend to have a lower baseline level of communication with their children about health, and they may respond differently to different messages coming from health organisations. So they might, say, be more responsive to radio adverts or something if that's more what they listen to. Mothers with higher baseline levels of communication may feel that they're already doing what the health message is saying, so they pay less attention to it. We didn't find any evidence that it helps to engage parents and children together to aim those health messages at both the parents and children. In terms of message content then, there was some evidence that educating parents on the impact of weight on their children's long-term health and the potential benefits of talking to children could encourage them to increase their communication or to initiate it. And also there was a fairly strong evidence that a main aim of any public health messaging should be to increase parents' confidence in having those conversations, and so that they feel that their self-efficacy is increased in communicating, and that they know what to talk about and how. Next slide, please. And then in relation to the first research question for this review, how should we advise parents to communicate? So what impact that communication has on children's health and well-being? We didn't find any intervention studies on this, so it was all from observational studies about sort of retrospective generally in terms of people or participants were asked sort of, has this communication happened between you and your child, and then taking measures of their child's outcomes, health outcomes. So what we found from this evidence was generally that ensuring conversation is two-way, so not just parents relaying information to their children, but also asking their children, what do you think about that? How do you feel about this? So keeping that communication open between parents and children was led to positive health effects. Obvious things like avoiding teasing, negative or controlling communication was linked with improved children's health and well-being, including children in decision making, which is related to that two-way interaction between parents and children. Similarly, including children in deciding what sort of language they would prefer to use. Do they like to use the term weight? Are they not comfortable with, say, words like fat or chubby, or do they not mind those? And then focusing on positive solutions, as in what children can actually do to improve their health, or what they can do as a family to improve their health, and making sure it's a one-way, or making sure it's more than just one conversation. So it's fine to carry on talking about weight or health. So how confident can we be in these findings from the 14 studies? Well, it was just 14 studies, and we did do a risk of bias and quality assessment on them. 12 studies rated as moderate, only 3 studies received strong quality scores. So there's a fair quality from them, we'd say, overall. But there were some sort of gaps in the evidence that we identified. There were not many studies on any one topic. So we included different topics like sexual health or weight or body image, such like. But because there were so few studies overall, it's hard to draw conclusions strongly about any one topic. There were no intervention studies, like Fiona mentioned. It would probably be unethical to research whether or not having communication between parent-child about weight or health behaviours versus not having any communication or having a certain type of communication. And looking at the effects of those, that's probably not going to be ethical and not going to be allowed to take place. So yeah, that's related to the last point there as well. So we also conducted a review of existing guidance. Like Fiona was saying, this has been done in a variety of countries now, including the UK. It tends to come from, say, charitable organisations, such as Weight Concern here, or has come from different university departments abroad. So doing a wide sweep of the web and asking our colleagues if they knew of any as well, we came back with 14 resources that we included. Just over half of them had clear expert authorship. The others didn't acknowledge any authors, so it's unclear how much evidence they've been based on. We looked at what content was common between all 14. There were some clear messages about things parents should do or should avoid, which largely relates back to what we found in the rapid review as well. So most of these guidance documents contained information on healthy weight and consequences of overweight. They all gave sort of avoid or these are positive things to do, and gave some suggestions for what to say in certain situations. Next slide, please. So the gaps and the weaknesses, though, in the guidance that we identified was that none of them dealt with social media, which has only recently, I guess, become more of an issue, particularly for talking about weight, and perhaps particularly as younger children become heavier users of social media as well. There was a tendency, which perhaps links back to the research that's been done in this field on focusing on mothers and girls around weight. There's less research has been done with fathers and sons. So some of the guidance documents focused specifically on mothers and girls. Some of the guidance that we found obviously wasn't done in the UK, and it might need slight tweaking to be sort of acceptable to a UK audience. And like I said before, some of it didn't have clear expert authorship, so we're not sure about how much it was based on actual research evidence. But we did see, we did see we did identify three that were, we felt quite strong contenders for adaptation. The final study then we did was interviewing children. So we recruited children between 9 and 11 years old. Like Fiona said, it's always been a struggle to recruit for this type of research, and we've only had 11 participants so far, but a mix of boys and girls. We tried to do something slightly different, bearing in mind that we've gone online and that this was talking to younger children who might not be so comfortable with an interview, the sort of standard research interview format. So we used some story cards, which we showed them online via Zoom, and then just asked them some questions about what they felt was going on in the story. This also helped to make it not about them in particular, but we could talk about the characters in the story. So we were focusing on a story about a child being weighed through the NCMP process, and then their parents getting a letter telling them that their child was overweight. And we also looked at some master studies which had done similar things with children using focus groups about what they felt about being weighed. Next slide, please. So these are just some quotes that we got from these interviews, both on children's views on talking with their parents about weight or not talking about it. So generally, children did feel that they wanted to talk with their parents about weight. They wanted to get that information, and they generally felt that their parents would be able to help them if that was what they needed. If weight wasn't talked about, on the other hand, there might have children reported that they might feel bad about their weight. Not being able to discuss it might make it more of a taboo, or might make the children feel like they weren't accepted. Next slide, please. So the key themes that we found from this, just focusing on three, were that children are generally accepting of being weighed and measured. Particularly to younger children, it's just a matter of curiosity, that it's their information and they want to know what they weigh. But they were sensitive to the fact that weight is a sensitive issue, and it should be felt that it should be discussed in private, so just between the child and their parents. They could see that it could be potentially damaging or harmful to talk about it with other children in the playground. So they could see why the NCMP letters are sent back to their parents rather than given to them at the time. Children did understand that diet and physical activity affect weight and health, but there was evidence that they'd need guidance in order to change their behaviour safely. There were some misunderstandings about how to improve their diet and what was healthy. And finally, then, that children thought their parents should tell them about their weight. They felt it was their information and they wanted to know. But they also, really importantly, were confident that their parents would be able to help them if that was what they wanted. And that was why they wanted their parents to talk with them about becoming healthier.
Thanks, Liz. So it was interesting that children had a lot more confidence that their parents could help them than their parents did. So those were the three new studies that we did as part of this process. And I can see Liz's face. She's going to shoot me. I didn't show her this slide. I was trying to show action shots of Liz and I doing podcasts or short video casts as part of the Delphi process. So I tried to pick a flattering one, Liz. But we took those three sources of information and boiled them down to some summary information that we could then share with the experts that we wanted to recruit for our Delphi process. So I don't know if you're familiar with that, but it normally is an iterative process that you do with experts to try and get closer to agreement on what the appropriate way forward is. So we recruited various experts, as you can see in the list here, from our known contacts. So we looked, in terms of academics, we looked at who was doing published research in this area, working with Public Health England. We were linked in with various school nurses and GPs and parent representatives, and parents, and public health professionals who are working in this area. And we also put a call out on Twitter, which gave quite a huge response of a really varied range of people, but just showed how interested the world out there is in this topic and how divisive it is about whether or not you talk to children about their weight and what you might do to do that safely. So you can see, well, we invited around 39 people in the end to the Delphi, and about 28 of them took part, 25 of them taking part in both rounds, which we felt was really positive. And you can see the pictures there, that we would try to make this engaging by making sure that we didn't give too much information. So we boiled each of those studies you've heard about down into a single slide to try and draw out the key points, although we did make full information available. And then from the comfort of our kitchens, Liz and I did just brief 3 to 5 minute pitches about what we wanted people to do each time. So it wasn't too dry and on paper. And we were really pleased to keep most of our participants in the study this way. At the end of the second phase, we also ran a webinar just to facilitate some discussion around the topic, because it's really hard to have all these experts working with you and not being able to tap them for more information. So what are we not considering beyond the questions that we're asking? So what we've done is we created some guidance that we thought was a starting point. We shared that the first time, sent out a survey, asked for feedback, of which we got loads, and Liz spent a lot of time in January digesting. And then we made some changes again, and then sent it out again, following which we sent another survey and a webinar to see whether we'd done something that improved what people wanted to see. And it generally went out, I think, actually better than we'd expected, considering we had some quite diverse views on there. We purposefully engaged with eating disorder charities because we thought we should hear their accounts, as well as people who we knew were sceptical about the NCMP, just as much as people who had designed it and had been supporting it for many years. So it was quite a mix of views there. So to look at what we found through that process, that some of the challenges were around whether or not you should ever, as a parent, use the term weight about a specific child when talking to them. Some people felt you shouldn't, others thought that it remains an elephant in the room if you don't. There is this tension that we're probably all familiar with about how to get the nuances in of what you want to say while being brief. And this we found particularly challenging around how to support parents who might be overweight themselves, or who are currently trying to diet or manage their own weight. How do you do that in the face of not influencing your children negatively? Doing that briefly is hard. We also wanted to include some stories or narrative messages in the guidance, because we've done some work in the past that shows these are a really good way of supporting self-efficacy for change, so showing how people can overcome what's initially very distressing news, and they're particularly useful at communicating with people with less educational levels. But that's hard to accommodate within a short document. And also we found that we hadn't done as well as we'd hoped in representing diversity, particularly in pictures, for example. It was interesting, we used photos which are from the World Obesity Organization. I may have got that slightly wrong, I can look it up, which are meant to be non-stigmatizing photos of parents and children who are overweight, who have obesity, doing positive things, and portrayed in positive ways, but they're also portrayed, it turns out, in very middle-class settings, so it might not speak to people in lower socioeconomic groups. So that was pointed out to us, and we tried to accommodate as well. But overall, we found lots of agreement on this idea that we should be focusing conversations on changing behavior, or eating more healthy diets, or getting more exercise for growth and health, not for weight. So we're de-emphasizing weight. emphasizing a family-based approach, so people change together. It isn't a problem for children, but this is a challenge for the whole family to get more healthy. Also, what came across was this acknowledgement of the importance of the role modeling power of parents. So if you are a parent and you're dieting and talking about dieting, or talking about what a pain it is to have to do physical activity to manage your weight, it doesn't necessarily matter what you say to your child, because they're absorbing that message from you in another way. So there was a necessity really to try and challenge parents on that front. At the same time, we wanted to avoid blame, because it is very tricky for anybody to manage their weight living in the society we do. It isn't parents who have changed and got worse at this over time, it's the environment that's changed. So that was the outcome of our study. The guidance we have in pilot phase at the moment, so it's not quite yet available, but it's getting there. We've had good feedback so far. So just some reflections on the process. The Delphi study that we ran, as I say, it went much better than we thought. Took a lot of preparation and a lot of thought of how to make that information digestible. But we think it was made helpful by having very clear timeframes, where we tried to do things quite quickly so that people weren't left hanging, to keep that momentum, but people knew what they were committing to and when. We think the videos helped, so thank you to Angel for making us do those. It was hard medicine to take, but I think they did help. Doing those summaries really succinctly, we got positive feedback about. We think the webinar was an enjoyable opportunity for people to get together, which made it feel a meaningful activity. And I mentioned before, we tried to invite those diverse views, so that helped us to make sure that we had accommodated and we thought of all the unintended consequences that we could do. As part of this process, though, we did give ownership of the guidance to PHE, because we thought this would be the best way to get it adopted and into common use. So the pros of that means it will get adopted quickly. I think it's really positive that they were interested in doing that, and they're very invested in using it, and it should be able to be applied at scale. And they're also very expert and have fantastic insight in how we do some of these things. However, it means we've lost control of the content and format, so we don't know that everything that we wanted in it will end up communicated, but we are at least able to have a say in that. And finally, academic benefit, because that's what most of us are about. I think it's been a really positive process to be able to bring together a body of work. Individually, some of those studies are stronger than others. Some of them, wouldn't get returned in a ref return, for example, but they're adding to a story, and we've been able to bring those together in a way that we hope will have some impact. Although, as I've put below, I don't know how easy it's going to get this project published, but we will have a go. I think that's it for us. Thank you for listening, and we're very interested to hear your thoughts and questions.
Okay, thank you, Fiona. That was a really interesting presentation. I put out I forgot to say at the beginning, but I put out a little chat note to say if anyone's got a question, please post it. Unfortunately, my internet signal then went for 10 minutes as I was frantically running around the house trying to get it sorted out. So I may have missed the questions. No? Okay.
That's the best bit, Julia.
And I'm really annoyed about that.
You could have kept all that to yourself, Julia. No one would have known.
Well, that's not me, unfortunately. So let's open the board then for questions. If anyone's got one, then can we do hands on here? Can we do a hand?
Faces would be nice.
Hand up thing. Okay, I will, if anyone's got a question, put it in the chat. Just say I have a question, and then I can.
Do you want me to start?
Yeah, you can start. That's fine.
First of all, Fiona and Liz, thank you. That was a really great presentation, and it was lovely to see kind of the whole journey. As I've been part of it, it's nice to see it all in one place. So thanks for the presentation. I can see Joanne's got a question, but I'll ask one quickly first, which is where are you hoping to take this next? What do you see as the next steps from here?
Well, we're egging PHE on to get this into practice. So what they are doing at the moment is they've, I don't know if you saw this, Angel or anyone else, but they were advertising for some local authorities to do some projects around improving the NCMP through their extended brief interventions. So what they are proposing, which will start in about September or October, which would be, I think, really getting phone calls alongside the letter in real terms, with maybe slight variations. So they are going to ask those pilot sites to use this alongside that, which would be great. But they need the piloting data first to show that it's acceptable to parents. And they also, as I kind of alluded to there, are going to chop it up and make it more manageable to parts. So I think at the moment it's about 19 pages, but we'd never intended it to necessarily be a 19-page document. We think it will work really well as a web page, and we'd like to have the stories as videos and so on. So we're still pushing for that to happen. So in terms of getting it out there, I think that would be the next phase, and probably good timing to get it piloted as part of those extensions. But then we will also, once we've finished the pilot phase, also start seeing where else it could be used, because it's not just the National Child Measurement Programme where parents are finding they need to initiate that conversation or it's at risk. And then we want to write it up as a package, really, just to say here's a way of doing something that brings together this work. And I guess it's going to need a bit of championing to get out there and keep out there.
Thank you.
Thanks. Joanne, did you want to ask something?
Yeah, thanks, Julia. Thanks very much for the talk. It's actually really interesting to hear from this side. So my research is in PE, and so I hear a lot of sort of critical discourse about obesity, as in sort of critical analysis of it, and the difficulty of dealing with moral panics and that sort of thing. So I was just wondering about why why overweight is used as a proxy for health. And you mentioned one of the things was if sometimes a child doesn't look overweight, but so how's that decided that a child is overweight and therefore has poor health, and why, and whether then there's a part of your recommendations, as we saw with what's gone to PHE, that was really nice use of the different parts of the different bits of evidence, whether that's part of your recommendations to kind of break that connection between overweight and health, that there's other markers of health aside from weight.
Yeah, and that's a really interesting topic. And of course, what we haven't touched on here is there is a question of should we be at least measuring or feeding back to parents at all. And there are schools of thought who think we shouldn't be. So by joining in with the PHE, I'm on the side of, if we're going to do this, let's do it better. But some people do argue against that. I think there's a lot in the communication. So I don't think that necessarily overweight is being conflated with poor health now. It's a risk of poor health in the future. And I can't remember offhand the statistics, but there's quite a lot of work that has been done on how weight or excess weight tracks from childhood to adolescence and on to adulthood and so on and so forth. And that is the reason why people are looking at childhood overweight and obesity, because it tracks quite closely to adulthood. So and people think, well, by the time we get to adults, it's too late. We shouldn't be intervening then. We need to intervene downstream. And it might be to influence weight, but it also might be to influence the behaviours that we know would be protective of later life obesity. So can we get children more familiar with eating healthy foods and or healthier foods, without implying that they're not getting a healthy diet at the moment, and can we get habits there around physical activity? so that that child has a lesser risk of becoming overweight and developing whatever non-communicable diseases later on. But that's not necessarily what you're hearing by the sound of it, and that's not necessarily what parents are hearing, if they're hearing that overweight means you're unhealthy now. So it is about the nuance of why are we concerned, and what that means for your child's health now.
Yeah, so I wonder whether there's other markers like diet and what people are eating and their exercise levels or physical activity levels, as whether they are also then, I don't know whether that tracks through to adulthood in as risk factors, like sedentary behavior as a risk factor for in later life. So
Yeah,
which wouldn't have the same stigma. Yeah,
I think it is less easy to measure them, so it is less clear. So that is harder to do. I'm not sure it's any less stigmatizing. Parents are very sensitive about being, and I say this not as criticizing parents, but I would be too, be very sensitive. Somebody saying you're not giving your child a healthy diet and you're not making them physically active enough. And we had quite a lot of feedback actually during the Delphi process to take out sections where we had implied that, so that we don't say a healthy, we don't assume that they're starting off from an unhealthy point. And also we have to think about how this fits with that systems-wide approach, whereas it's not necessarily, it's not necessarily within the power of an individual person to overcome all these barriers. I was at a talk over lunchtime actually about changes to universal entitlement to free school meals and how that had changed child obesity levels, only by 1%, but by 1%, which is pretty good if you think about it on a national level. And actually, though, that sort of whole-scale approach that doesn't require individuals to change behaviour and worry about it and make parents anxious, that's something we also could consider. So, but I think children they are teased about weight at school. They know particularly when they are living with obesity, they will know that they are heavier than their peers. So parents not talking about it, is something we should be looking at the effects of that, because there's less opportunity then for their child to hear from the most supportive person who's most on their side about an issue that they may be teased and stigmatized about.
Yeah,
so
lots to think about. Thank you very much. Yeah.
Just related to that question, I was going to ask if there's been any talks on using waist circumference instead. It might have the same level of stigma attached to it, but it does track more closely to long-term health outcomes. So it's a stronger predictor of disease risk than just weight. And it's also really difficult because children are growing and developing at such different rates. They're so individual. Although there are, the cutoff points by age and by sex, that doesn't account for development and so on. So I wondered whether there have been any conversations around using potentially something like waist circumference.
I don't think PHE are considering that at the moment, because partly because it is the variability that you get from that. So training up people to do it. I mean, Julia and I have worked together before on trying to work out, I can't remember the term now, you have to find the midpoint between the top of your hip bone and the bottom rib and measure there, and training people to do that accurately is quite tricky. So to do that at a national scale, and also it involves rummaging in their clothes more than weighing and measuring. So for that reason, I do sit on the Public Health England advisory board of the NCMP, and it is never measured, but you're right, might be a better predictor. But there is quite a lot of research on your other point about development and also ethnicity, and how we should be reading those BMI scores and adjusting for that. So we've got a paper that we've done with Sean Cummings at Bath, who's expert in maturation. We've taken a couple of cohorts now of students and looked at what difference their level of maturity makes, and it can make quite a lot, particularly to girls at that 11-year-old age. About 30% of them who are classified as overweight or obese could be actually a healthy weight. So it's about kind of looking at how we can make that more accurate. And while I think that's worth doing, it doesn't get around the fact that those girls, if they are a higher weight than their peers or other peers for age, is weight going to be an issue, and can we help parents to talk to them positively about it? It's still going to be there. However, wherever the cutoffs come, there'll be people above it.
Yeah. No, it's really interesting. I did have another question. I'll ask someone else. I'll ask around. Did anyone else have a question? Yep. Go ahead.
Hello, thank you for that. That was really brilliant. The present two speakers. I had a question that you mentioned about, I think you briefly touched upon parents who also are dieting or talk about food around their children. You know, I think you said that might rub off on the children's perception of dieting, physical activity, and so on. And I just wondered, you know, whether things have been considered in regards to mitigating any negative impacts of language that might be used by parents, and the way they communicate things around weight, and in a way the way they might also add to the stigma that comes with that comes in schools and things around weight in children.
Yeah, I'm aware, Liz, of just talking on as I always do, so do come in and flag me down if you want to contribute. Yes, I mean, part of the problem with this was trying to work out how you can give parents some direct advice for what they should do without sounding like without blaming them. So many parents of overweight children will be overweight themselves, because we know that 2/3 of the adult population are overweight. So it's not going to be unusual that parents are aware of that, and a lot of people periodically make efforts to reduce that. So it looks like the advice from people working in this area and the evidence suggests that the less you talk about dieting and being active in order to reduce your weight, the better, in terms of children not getting hung up on weight as the only outcome that is important. But you can't police that. So we did within the guidance, we've got suggestions for how to turn a conversation around if your friend starts talking about dieting when you're out with the kids, or how you might talk a little bit differently about when you're going out, if you are dieting and trying to lose weight, how you as a parent can talk about that as to get more healthy, to feel more energetic, and give the rationale that is around something intrinsically beneficial rather than just weight. But children are going to be exposed to those comments, and also Liz did a bit about how to identify what are the words that are stigmatizing, but we might use them affectionately but without thinking, like chubby, and so on. So there is information on how to avoid that, but it's very hard. And I've spoken to people. One of them was actually the public health commissioner who commissioned the first piece of work that we did, whose child was identified as overweight in his 11-year-old measurement. And by the time I met her 3 or 4 years later, she said she just got to the point where she just found herself shouting at him, "Do you want to be fat for the rest of your life?" And she goes, "And I hear myself and I'm horrified, but I was just pushed by a normal parenting challenges to say this thing, and it's hard to hold it back." So we can guide and we can try and help people see what the ideal would be, but it's going to come out.
Great, thank you for that. I just wonder if that same mentality also transfers to healthcare professionals, where they might also use this type of language. And I know the scope was only with parents, but if you could transfer what you've done to healthcare professionals.
Yeah, I think they'll be interested, but they have an excellent resource already that Paul Chadwick has developed. But
yeah.
But they are actually really interested in this as well. We know from the Delphi, and we're also interviewing school nurses to pilot the guidance with them as well, as they will know what questions parents ask and what words they find challenging. So
great, thank you so much for that. It's really brilliant.
Thank you.
Okay, well, unfortunately we're going to have to end there, but I'm sure if anyone else has a question that they really wanted to ask, then perhaps you could email Fiona or something like that, or Elizabeth. So thank you very much for your presentation, showing us about your amazing research. It's very topical and it's really important stuff. So yeah, I think, do I have to say anything else? official? Oh,
Oh, I
good.
think, good job. I think that's all, Julia.
Yeah.
Big thank you to Fiona and Liz. That was really fantastic. Thanks for being our speakers.
Thank you.
Well, thank you for the opportunity. It made us pull it together and got us focused. So it's nice to talk to you all, and be interested to hear how you get on with related work over the years.
Amazing. Definitely have you back.
Thanks.
Right, thanks
See you later.
everyone for being on the call.
Thanks.
Bye.